Hello, everyone. It's a pleasure to be here, and it's actually a pleasure to see how our community has grown over the past few years and how diverse it has become in terms of expertise and in terms of voices. So it's a great pleasure for me to be here. It's going to be a bit of a change of tone where I'm going to talk to you a little bit about policy, ethics, and governance. And excuse my raspy voice. I'm not trying to emulate Batman. That's not the goal, I can assure you. So I want to start with this slide, which actually represents a very important and emerging trend in the field of bioethics, which is one of altruism and reciprocity when it comes to participation in research, and especially participation for vulnerable populations. We're thinking about not just the individuals and the researchers, but we're looking at this as an ecosystem where you have multiple actors all play a very significant role. And that includes the public and includes the research community as well. It was either this picture, which I used ChatGPT to do, or a picture of me in my office, according to ChatGPT. By the way, I did that. And as a lawyer, for some reason, it gave me a Better Call Saul mansion, you know, with high ceilings. So I reminded it that I was an academic. And it gave me the same picture, but with a longer beard. So that didn't really work that much. So I went for this one. We've heard a lot about fragmentation, right? This is actually a real image from Mansoura in Egypt, right? It's called the Doctor's Street, right? So these are all doctors working in the same street, but all having their own clinics. And as long as you can stay there, you're probably going to need a neck surgeon, which is on the top left, actually. But it's also kind of to represent a little bit what we've been struggling with as a community over the past few years when it comes to not just fragmentation in terms of sharing the data, but it's also about collection, about storing, and also, to be honest, there's fragmentation when it comes to policies and when it comes to legislation as well. So quickly, and I know we're coming out of time, but I want to briefly introduce two activities. And I have to say that this work has been piloted and spearheaded by an academic associate within our Center of Genomics and Policy, Therese Knoppers, who I strongly invite you to go and listen to them presenting at the poster session number 24. So two activities. The first one is about facilitating data governance and sharing across ACCESS members. And the participants here, and this is a survey, so we have researchers, legal representatives, and contract staff across ACCESS partner institutions. And I'll explain a little bit why we wanted to do this. So you're going to see as part of our work is to look at what policies do exist and what are the common elements of good governance. You're probably going to hear a lot of keywords that you're used to hear. But in reality, the situation is, well, it's not the policies that will tell us exactly how things are going to go. These are aspirational in nature. What you need to know is, do the people who facilitate this actual access, I'm talking about research data here, are all on the same page when it comes to what you're trying to achieve. And this cannot be done without the folks who actually work on the contracts, negotiate the contracts, and you can always work and do good governance by ensuring that your access process, especially the review of applications for access requests, can happen very efficiently. And in Canada, depending on the initiative and how much data they have, it could be between 3 and 15 business days to have an actual review done. Where it's sometimes, delays start happening is when you're actually signing the contract, the data sharing agreement. And this can take 3 to 7 months sometimes, right? And this is heavy on the research community. So the survey examines professional perspectives on data sharing, including the role, definitional clarity, ethical principles, compliance measures, and the use of multi-institutional and external data sharing agreements. It also explores challenges and barriers in data sharing, their impacts on research, and potential solutions. So that's the first activity, which I'll focus a lot of my presentation on. Second activity is one that we will be starting in 2 months. from now. And this is about fostering communication of patient data and access to results. And here the participants are adult survivors of childhood cancer and parents and guardians. The survey here, what we're trying to do is examine needs, experiences, perspectives, and barriers related to access to medical records and research data. But we also want to explore experiences with return of results, interest and accessibility of research information, and also try to support meaningful data access. We have started to engage with persons with lived experience, looking at our survey, trying to gauge, accessibility in terms of the questions that we're asking. Are there questions that we should ask that need to be there? And also, there are a lot of sensitivities in terms of how we ask those questions that we wanted to get some feedback. But that won't be the only time where we will engage. We'll make sure, especially after we get the results, to engage again, and also when it comes to deliverables and future dissemination. Core elements of good data governance, right? So transparency, certainly heard of it, right? And these are a sort of a result of a comparative analysis of policies, whether in Canada or internationally. And a lot of it is also based on the work of the Global Alliance for Genomics and Health. Developing clearly defined and accessible information on data sharing. It's not always the case when you are making data, research data available. Not every project has a website or a portal, right, where there is information about the process, or about the nature of the data, or about the adjudication process, so the review process. You have open access and you have controlled access. Well, if you're going to go through a controlled access process, who is going to review? How is this submitted? And what are the timelines that are involved? Accountability is important, and this is where legal contract teams play a very important role in this discussion, because we want to institute best practices for monitoring and responding to non-compliance. Engagement, right? We've done this, and it's very important to do this, and I think ACCESS is clearly showcasing the importance of facilitating the contribution and co-design with patients and participants and persons with lived experiences. Data quality, data security is a must. And thinking about this, you have to think about establishing proportionate data security measures. Understanding what are the laws and regulations in your own jurisdiction. I mean, I come from Quebec, and privacy law has been updated and changed over the past few years. And so we have new requirements, including institutional requirements that everybody needs to know. Again, here is the proportionality element that needs to come and play a very important role. Your data that you're going to be making available is not all controlled. There's going to be probably open data, aggregate data that could be made available on a portal where people can download, but there's also controlled access data, and this requires a efficient, economical, and equitable process to make it happen. For researchers who also work on collecting, curating, and giving access to this data, there needs to be recognition and attribution for their work, and there's a lot of guidelines around that. And of course, when it comes to accessibility and dissemination, is always trying to maximize the accessibility of data through streamlined processes. Thinking about, always a balanced effort between the risks and the benefits. Risks of sharing data, the benefits of sharing data, but also, keeping in mind the risk of not sharing. And during the pandemic, this became very tangible. And why is this important? Is because we have to understand the process when it comes to collection and integration of data. You can always have prospective collections where you're trying to recruit participants de novo, right? So this requires a consent template. You need to have a governance framework in place. You need to have policies around sharing, publication, incidental finding, what happens if your database closes, and you need agreements, right? But there's also retrospective collections. And again, the pandemic was a good example where we came up with projects that required or needed a certain number of data, but that we couldn't really recruit everyone from one single project. So we needed to work with other researchers to make this happen and integrate their data. But they also have been consented differently, right? So how do you work this out? And this is where we come up with the idea of consent filters. We come up with core elements, things that we want to make sure that everybody whose data is integrated within this project respects and has consented to. And then we work with Research Ethics Board to make sure that, if it's not there, can it be interpreted more variedly? Are there other, processes that we can put in place, including notifications or reconsent if ever this is feasible? You still need to do a governance framework. There still needs to be agreements, and agreements sometimes to facilitate the process are agreements of actually giving custodianship to another institution, right? So the data is there and you want to send it to another institution, but you want that institution to be a one-stop shop. If you remember the delays that I mentioned to you at the beginning, so imagine multiplying this by 4 or 5. That takes a long time. So sometimes the process requires that we go through one-stop shop, and that requires agreements. So I'm giving you some preliminary results, but again, I strongly encourage you to go and visit Therese Knopper's poster to hear a little bit more about this. But these are some preliminary results from the participants. So we have recruited 22 people overall for now. We still need a little bit more legal representatives. So if you know any in your institutions, please contact us so that we can include them. But data sharing was consistently framed as a foundational for childhood cancer research. Respondent emphasized the system-wide nature of data sharing impacts, spanning scientific progress, ethics, but also public trust, right? Remember that first image that I brought. People are coming in and providing data and sample because there is an element of trust. The open text responses that we've received so far emphasize the need to operationalize a lot of these ethical principles that I showed you through streamlined processes, reducing bureaucracy and going through trusted coordinating bodies. And again, we always have to align with patient and family expectations for socially beneficial data sharing, right? We have to remember why we're doing this, again, always, all the time, right? We have to remember why we're doing this in the first place. And if we do remember that, then we understand that there is a scientific imperative to data sharing, but there's also an ethical imperative to do so efficiently and responsibly. While all sites reported use of data sharing agreements, conceptual misalignment persists. Only 26.7% of respondents believe the partners or the stakeholders share a clear common definition of what actually a data sharing agreement is. And just to give you a bit of again, preliminary results on the impact of issues with data sharing processes on research, specifically within the ACCESS community. As you see, a lot of them had to do with delayed research project, delayed scientific progress. A big one was increased administrative burden, reduced reproducibility, data gaps, hindered collaborations, reduced public trust. So you can see here, it's not just about contracts and just not about, ethical and privacy concerns. You can see that there is a lot that relates to operations and relates to science. For activity 2, what we've done so far just to prepare the grounds for our empirical research was to do a horizon scan. And this is what we found so far. I mean, patients have a recognized legal right to access medical records across Canada. However, procedural requirements and thresholds for refusal vary by jurisdiction and by institution. And unlike clinical records, research data often lack standardized access routes. So return of individual results is not guaranteed and may depend on clinical relevance, analytical validity, institutional policy, privacy legislation, or actionability thresholds, right? And these can be interpreted differently. And this is why it's very important when we think about this to think about it from a multi-institutional standpoint. You're going to be working with many institutions. Make sure that you have a common understanding of how you define this. And survivors and families report fragmented systems, administrative burden, dispersed records, contributing to this unmet information. If anyone here is interested in participating in one of our surveys, I strongly recommend that you scan this QR code, but you'll also find it on our poster as well. So just to finalize, I have 1 minute left or even less. Reciprocity, altruism, hopefully aiding into this collaboration, including international collaboration, translating this knowledge to the clinic for the better health of the population. You need good governance, and you need to make sure that all the actors who play a role in access make sure that they're all on the same page from the beginning, right? So anticipate in order to innovate, and this is going to create but also sustain this public trust. Thank you very much for your time.